process of sex, or it could be indirect process of sex. So when I say indirect process of sex, I mean that STIs could get through people directly as in the contact of having penetration or intercourse, or could also be as a result of objects that are used for penetration. So sharing is behind also object like sex toys, for example. So if indiscriminate sharing of sex toys, right, could also lead to the passage of STI from one person to the other. Now, when a woman becomes pregnant, her body system becomes quite fragile, by the way, especially as it pertains to her reproductive system. That is why we have the cervix mucus block that closes up the vagina, that it closes up at our cervix, which is what separates the womb from the vagina and different parts of the body. So it's not just so when STIs affect a pregnant woman, the problem is not just one person is affecting in quote, it's putting two people at risk. That's the mother and also the baby at risk at every point in time. So the first question often asked is, can I get STIs when I'm pregnant? And the answer is yes. Pregnancy does not give you an immunity against STI in any way. It doesn't. So there is no saying that because you're pregnant, you can have STIs. No, it doesn't work that way. You can still have STIs. As a matter of fact, if you were using, because some people use condom as a form of protection. Some people use condom as a form of protection, mostly to prevent pregnancy, not even for the STI. So if you're now pregnant and you decided that you don't want to use condom any longer because you're now pregnant, you can still expose yourself to STI. It's essential that this is established that yes, it can happen, right? Okay, so when we talk about symptoms of STIs in pregnancy, the usual symptoms. So the same symptom you would have for an STI before you're pregnant is the same symptom that you're going to have if you get pregnant, if you're pregnant and then you have STIs, or if the STI was done for you, because some people have already had the STI and then they got pregnant, even with the STI, or if you've already become pregnant and then the STI comes, you're gonna have the same symptom. Um, Rashes, itching, discharges, right? So these are almost like the same thing that could happen. And the thing about this is that because these symptoms oftentimes depict to an extent or are similar to an extent to the normal symptoms. When I say normal symptoms, I mean like to the things that women experience when they're also pregnant. So it's easy for it to go under the radar. So you may have itching and you'll be like, it's just the normal itching. I've been itching since I became pregnant, maybe due to alteration in the vaginal pH, right? So sometimes it goes under the radar. So that's always the issue with the symptoms. And other times, some of the symptoms are silent, or maybe these diseases are in their latency period. For example, if it's like gonorrhea, right? So you may not even know that you have the disease because you're feeling that it is like in its latency period, that it's silent. So nobody ever has to, know about it. So that's the issue. So the issue with having a second pregnancy is that the symptoms may mimic the normal symptoms also of pregnancy, or sometimes it may be in its latent phase or in its silent phase. So these symptoms go under the radar, and the person does not even know that they are pregnant with STI. And this is why it's essential when we come down to diagnosis that every pregnant woman must be screened for sexually transmitted infection. Some of them are quite common. So, for example, in Nigeria, there's a very high likelihood that a pregnant woman will be screened of HIV, and syphilis. Most likely, I think we now have a strip. We now have a combo strip that can, from one blood sample, can test the two. So now this test strip, or should I say, yeah, I should call it that. This test strip is now being used So pregnant women are oftentimes screen for HIV and also screen for syphilis. But there are other ones that could go under the radar. You can screen for gonorrhea, chlamydia, herpes, genital herpes, as the case may be. So these are it's essential that this screening is done. It should be because unfortunately most of these are often picked mistakenly, if I could say that. So you're manifesting a symptom and you're manifesting a symptom as a pregnant woman. Pregnant woman is manifesting a symptom and the healthcare provider is suggesting a test. But then it should be a routine screening, especially from sexual history, because sexual history is taken. Now, this sexual history is the sexual history at the moment and also before, not just for the person who is pregnant, not just for the pregnant woman, but also for the partner of the pregnant woman. If you're a pregnant woman and your spouse, doesn't observe the ABC of, safe sex first, does not abstain, that's when he's not having sex with you, doesn't abstain, is not faithful to you as a partner, and the CPAP doesn't come correctly and consistently use condom. That's I mean, after you're pregnant, please, it's essential that you get your partner spirit. So if you do not know the sexual issue of the partner, you're not okay, your partner is seeing other people, your partner is having intercourse with other people, it's essential that you get yourself screened. Now, this is to rule out any risk, if I should call it that. So get yourself screened, get your partner screened. It's not out of place that you become pregnant, already the pregnancy has been achieved, and you insist on your partner using protection, that is condom. It's quite essential that you do that. So what are the possible treatment options? Now, just like every other disease, the treatment option is dependent on the cause. So if it's a bacterial infection like gonorrhea, there'll be antibiotic therapy. If it's genital herpes, there will be a viral treatment. Now it's important to know that viral diseases do not have cure. So every treatment option that will be given will basically do three things. It could be these three things, or it could just be each of these three things, or maybe a combination of both, or maybe of two of such. So the first thing would be to treat the symptoms. So every treatment of a viral infection is to manage the symptoms, is to take care of the symptoms. Secondly, would be to reduce the viral load in the body. And when this viral load in the body is reduced, it will now help that the mother does not transmit it to the child. It's quite very essential that should be known. So if you're doing a viral treatment, you better be it can't cure the disease. So it's just to manage the symptoms, reduce the viral load so it doesn't get transmitted to the child. So that is just what it is to reduce the risk of transmission. And also, and also, they may be made as a form of treatment for birthing plans or methods to be altered. So they may be made due to STI. It may be recommended by the health professional that a woman does not give birth via the vagina. Yes. So depending on the type of STI, depending on the stage of the STI, like the activity. So for example, let me use a core example that may need recommendation for birth via STS, genital herpes. So if it is at the active phase of the genital herpes, it may be advisable that the woman does not give birth through the vagina. Sorry about that. So it might be advisable that the woman does not give birth via the vagina. It's quite essential for that. So you need to know that. That's why you need to go to the hospital. That's why as a pregnant woman, you need to go to the hospital because these are the things that could. These are life-changing decisions because the child could be born with a disease that they do not know anything about. So prevention, like I said, first is for you to screen yourself. That's the way to prevent routine screening of the sexual partner. So screening, especially when you're pregnant, go for antenatal and antenatal you will screen. It's essential, it's a routine screening. And then proper care for sex toys. I think I mentioned this when we were starting. Care for your sex toys if you use sex toys. There can be portals, there can be pathways for you to contact various diseases. So care for your sex toys, clean them appropriately, store them appropriately if you use it. Please reduce indiscriminate sharing. Yes, I know that there is love in sharing, but there's certain things that you shouldn't share. Or even if you share, realize that if you share sex toy, it's almost at the same level as having multiple sexual partners, right? Especially if appropriate and disinfection is not done on that sex toys. So it is essential. Right. So today we were sharing, talking about STIs and pregnancy, things you need to know from looking at what it means to the symptoms, to the kind of people that it affects, right, and to the treatment option and possible prevention. So I want to talk about some frequently asked questions. So that we encounter when we talk about STI. One of the most frequently asked questions is always, if I have STI, can I breastfeed my child? I think mothers are often worried about this. Is breastfeeding possible when you have STI. Now, it depends. It depends. There's no yes or no answer. First, it depends on the type of STI you have and the amount of the virus in your body. Because some of these STI can pass through body fluids, and the breast milk is also one of the body fluids. So that will decide. So if you have a high viral load in your body, for example, for HIV, it's not recommended for you to breastfeed. Secondly, if you have sores, maybe sores due to herpes or syphilis, it is not recommended because these sores are pathways, where the disease can pass to your child. Now, another thing to consider when it comes to breastfeeding is One thing to consider when it comes to breastfeeding is the medication for treatment. The medication for treatment, very essential. The medication, because some of this medication may not is not okay to be passed to the child, so it may pass through breast milk. And now this brings me to, I think I forgot to mention this while I was talking about treatment. In as much as you get almost the same kind of treatment in terms of treating an STI, right? But then there are alterations because of the intricacies of pregnancy. To this effect, it is not advisable as a pregnant woman, let's say you realize that you have maybe gonorrhea, which is a bacterial infection, and you feel that you can just take any antibiotic because antibiotic goes against bacteria. No, because the pregnancy that is growing in your womb alters your body. There are certain drugs, right, that can affect the baby negatively. It's essential that you know the drugs you're taking, hence the need for you to meet a medical professional who will direct you on the right drugs to fit the infection you have and also to fit the fact that you are a pregnant woman. So another question that people usually ask is vaginal birth, which I think I've mentioned. Will I still be able to give birth from the vagina if I have STI? People ask this question. And I said it also depends. Now, it depends on the type of STI that you have and the level that you are. I talked about the fact that if it is active stage of herpes, oftentimes it's not recommended because the baby can pick the disease via the birth canal. So all these things can be decided as you work with your healthcare professional. I'm a pregnant. You go to your healthcare professional, and after test, if you have a sexually transmitted infection, this will be okay. Now, what are the complications? Now, these are the issues. So, what will happen? So, someone will be like, it's none of my business. That doesn't concern me. So, let me point out a couple of complications that may arise if you have STIs and then you don't go for screening. Maybe you have to, carry the pregnancy with the STIs and then you come to delivery. First is the fact that you could transfer or transmit this disease to your child. So the innocent child is born with it. Sometimes it could be disease that lasts, that may need a lifetime treatment like HIV. So even if you're not doing it for yourself, please do it for that innocent baby that you're carrying in your womb. That's one. Then we have complications of in pregnancy, from being born with deformity to low birth weight to preterm birth to the possibility of dying, even the baby dying inside the uterus, because yes, it can happen. So there are a whole lot of complications. We even have birth complications to the mother. So it's essential to prevent this that you get pregnant women get screened. So if you're listening to me, you're a husband, you're a person of authority, you are a pregnant woman, you're a lady, please share this information for women to know and for people, policies makers to know. People in religious organizations should also jump on this and ensure that the women around them are screened for sexually transmitted infection, not just for themselves first, but not just for themselves, but also for their children. that they are carrying. So this has been the size of our package from the Intimate Matters podcast, your go-to podcast as it pertains to issues of sexual and reproductive health. Do well to like this video. If you're not already subscribed, if this is your first time watching here, please click the subscribe button, share the video to people who really need to hear it. If you have questions, please drop it in the comments. We'll be glad to answer your question. Any recommendation you may have as pertains to topic we should cover, please, you can do well to drop it in the comments. Or you follow us on all our social media platforms on Facebook, on TikTok, and YouTube, and also on Instagram. Follow us and drop your comment. You can join our personal WhatsApp group. There you can get to interact with me and also interact with people who will be on this podcast. I know I've talked about amazing topics so you can get answers to your questions. So thank you so much for joining us. Until we come your way next week, we will bring another very exciting and educative content on sexual and reproductive health. My name is Nurse Akwaopan, also called the Gig Nurse, and I'm your anchor and your host on the Intimate Matters podcast. And I'm saying goodbye for now.